Hey guys, Charna here at 180 Wellness in South Lake with Dr. Parkhill.
Hello.
And I have the crud. I have major sinus pressure. I haven't been able to sleep at night because I can't breathe out my nose. And it is awful, especially when you're pregnant. And even when I'm not pregnant, I try to do things natural. I try not to medicate myself a whole lot, but now that I'm pregnant, I especially don't want to. So I'm going to do the best thing that I know to do to take care of my sinuses, and that is get adjusted. And Dr. Parkhill is going to explain why getting adjusted helps, and we're going to show you how an adjustment for your sinuses looks.
Okay.
So take it away.
So first, let me just talk to you a little bit about what we look for as chiropractors, especially if somebody's presenting with headaches or sinus problems or congestion, which is rampant right now. We're seeing patients come in hacking everywhere, which is a beautiful thing. So what we look for is in the upper cervical, the first two bones in the neck. There's 7 bones total, but what we look for is the first 2 bones, number 1 and 2, and it's called the atlas and the axis. And as chiropractors, we look for a term called subluxation. You don't have to remember that, but it's thrown around a lot in our office, and it's important. So the vertebrae is not necessarily dislocated, it's subluxated, meaning it's misaligned enough to put pressure on the nerves, and in her case, the nerves that go to her sinuses, so from here up to here. And so what she's experiencing is a lot of congestion from that, but we're looking for the underlying cause, not just treating the symptoms, especially since she's pregnant and we don't promote antihistamines here. So, but we're looking for that subluxation. So on her, what I'll do is and we'll do this in just a second, I'll do some pressure points across the sinuses, which patients love, and then we'll do an adjustment in the upper cervical, very gentle adjustment, and relieve pressure off those nerves that go to the sinuses, and also has been shown to relieve headaches. So she'll be happy when she's done with that.
Yeah.
So, all right.
Ready? Here we go.
All right, this should be interesting.
Do you want me to move the phone?
Nope, you're perfect. So we'll start with just putting pressure on the frontal part of the head right here, and this is not painful at all. Would you say?
It's a little painful.
Okay, it's a little painful. And we try not to press too hard, but we also want to get...
But it feels kind of good.
Yeah, we want these sinuses to release and get some of the congestion out of there. You don't want these sinuses to be impacted and stay. You want them to release. So oftentimes when we do these pressure points along with the adjustment, we'll see the sinuses will give, and a lot of times I'll tell patients to grab a Kleenex, because when they start walking out of the office, snot's coming out, which is nice. But that's what you actually want. You want all that to release. And so we're looking for subluxation, and she's probably gonna make a face, yep, because we found it right there. That is the top bone in the neck, and it's out in left field right now. So we're gonna adjust that real gently, and just to make an easy move like that, just like that. And there are some pressure points in the back of the neck that we can press on as well. But how gentle was that?
That was good.
Yeah, that was awesome.
That was good.
So you should be good now, sister.
Awesome. Well, thank you, Dr. Parkhill. And if you have any questions or any sinus concerns, just give us a call and we'd love to help you out with them.
Yes, we would. Love you guys. Have a great day.
Bye, guys.